Hi, everyone. Welcome to our talk on using a cohort model to address cortical visual impairment in New York City. We're really excited that you took the time to join us today, and we're really excited to share the work that we've been doing for several years now here in New York City. We're going to just introduce each of us and explain a little bit of who we are.
Hi, my name is Gregory Santamoor, and I'm the Director of Educational Vision Services in New York City Department of Education. We have approximately 900 students who are visually impaired and receiving services in the 5 boroughs of New York City. Of those students, we have an additional estimate of between 15 and 20% who are diagnosed with cortical visual impairment.
Hi, my name is Chris Russell, and I am the project coordinator of the New York Deafblind Collaborative, New York State's Deafblind Project. Every state has a deafblind project that is funded by the Office of Special Education Programs through the U.S. Department of Education. In New York State, we have about 450 students currently registered with us from birth through 21 who are identified as having combined vision and hearing loss or deafblindness. We estimate that around 90% of those students who are registered with us have cortical visual impairment, which is an increase from the 3% that we initially had in 2015. So you're going to hear today a little bit about how this cohort has impacted our work in New York.
Hi, all. I'm Beth Brady. I work at Hunter College. I'm an assistant professor, and I coordinate the programs in blindness and visual impairment and severe multiple disabilities. We also have an orientation mobility and vision rehabilitation program as well. I bring the personnel preparation lens to the group. After starting in the cohort as a teacher for EVS, when I moved to Hunter, I asked if I could stay on it with a researcher role, and I was fortunate enough that Greg and Chris agreed to that. And so now I bring the research focus to it. So some of you might have just found us on the CEC Live platform and be thinking, what is cortical visual impairment? So vision loss, it is a particular vision loss due to damage or malformation in the brain that interferes with the child's ability to understand visual information coming from the eyes. This is compared to ocular visual loss, where the vision loss is related to the structure of the eye and what you might think of as, traditionally blindness. CVI is the leading cause of visual impairment in young children living in countries and regions with access to quality neonatal health care. Often the cause of cortical visual impairment is due to events like asphyxia, acquired TBI, metabolic disorders, epilepsy. You often might find students who have cerebral palsy who often have CVI or a hearing loss. If you're a teacher working with students with multiple disabilities, this is probably a phrase that you're hearing more and more often in your classroom. What's really important is that it requires different approaches to assessment and intervention as compared to methods traditionally that we've used in the past with students with ocular forms of visual impairment. If you'd like to learn more, we have created a fact sheet on CVI. The link is here on the screen. We'll include that in the handout. You can have access to it as well to learn more.
Okay, so I'll just briefly share with you some of the background about how this NYDBC NYC CVI cohort came to be. As you'll see already, we're throwing around a lot of acronyms, and all of those are defined in the slides as well as on our handouts. The CVI cohort, which we'll call it from now on, was established first in fall 2014 in collaboration between the New York Deafblind Collaborative and the New York City Department of Education's Educational Vision Services. Basically myself and my colleagues at the Deafblind Collaborative and Mr. Santamoor, who's here with us today. It was structured to reach all 5 boroughs of New York City, essentially through what's called a train-the-trainer model. If you haven't heard of it before, it refers to basically a coaching model that involves providing training and resources to individuals who then are intended to go on and provide that same training and resources to their own peers out in the community. So sort of a bottom-up model of spreading information and knowledge, involving TVIs, teacher of the blind and visually impaired, orientation mobility teachers, as well as paraprofessionals in each borough. So a fairly wide scope. We initially conducted a needs assessment with educational vision service professionals. And the intention of this needs assessment was just to sort of figure out what is your current level of comfort and expertise with cortical visual impairment? And also, what do you think the needs are out in your community in terms of resources, training, and what types of things would you like to focus on content-wise? That helped to create the foundation for what Greg will be discussing with you shortly. The original stated goal of the CVI cohort was right here on the screen, to foster leadership and expertise across all 5 boroughs of New York City in the identification of and referral, the appropriate assessment, and the design of appropriate educational interventions for students with CVI. Okay. Within the New York Deafblind Collaborative's grant, the grant that is supported by the Office of Special Education Programs at the federal level, we've actually written this cohort into the structure of our grant. Under the initiative known as the Qualified Personnel Initiative, we have what's called qualified personnel cohorts, and the CVI cohort is one of the main ones. We also have a hearing education services cohort, and we're developing other cohorts around the state with a similar model. The idea is that we have skilled providers of various different roles working within specific targeted departments of education, as well as agencies outside of the DOE across the state. Individual members who participate in these groups are selected based on their level of expertise, their dedication, but more specifically, their ability or their capacity in the context of their role to impact other service providers in their area. So it's important to us that these are itinerant service providers because they're able to have a reach much further than an individual classroom, and in some cases, even an individual school. Basically, cohort members receive resources, materials, and a wide scope of training, coaching, and additional participation in team activities. All of this is based on the field of implementation science. Some references for you if you'd like to learn further about it. And the idea that creating systemic change is best done through specific stages of what's called scaling up, and really sort of, from local to district to regional to even state and national levels of impact. Okay. The CVI cohort would be considered a community of practice, and there's a lot of literature guiding the formation of communities of practice and how to effectively run these COPs across education and even other fields. A COP, or community of practice, is essentially a group of people who work in a peer-to-peer capacity, or what's called a lateral capacity, in order to address a set of shared problems with a shared mission statement. These are people who all come to the table with various different levels of skill, but are focused around a specific agenda and mission. There's a theoretical basis specifically in social learning theory, which is the idea that learning results from varied perspectives and experiences, and around common goals that are agreed upon by the group, as well as situated learning theory, which is the idea that the most effective way of learning in groups is within the context of real situations. So this is a very hands-on cohort, and as you hear about the model and what we've actually done, it's all very specifically based in the literature around COPs. The National Center on Deaf Blindness, or NCDB, has established a great set of guidelines as well as a literature review for what constitutes a successful community of practice. So in terms of establishing a need, we know that cortical visual impairment is an area of significant content need for pre-service as well as in-service professionals. And we know this based on literature that shows that this is now, as Dr. Brady had said earlier, that this is now considered to be the leading cause of childhood visual impairment in the US. However, research and practice is relatively new in terms of what the implications of CVI towards education are, including in the field of educational vision services, TVIs, and orientation mobility instructors. So we do have a nice little developing field of research, and we have a nice developing field of practice. but there is still a significant need for additional pre-service training at a personnel prep level, as well as in-service training on a professional development level. There's also a significant need for identification and referral practices. And that's really part of how we recognize that this was a need that should be addressed and how this original collaboration came about.
Thank you, Mr. Russell. And I would like to talk about the cohort beginnings and some of the rationale behind why how we operate and why we do certain things. One of them was that there was a clear increase of children being diagnosed with CVI in the US. This is based on recognition from multiple sources, such as Lewick and Dutton in 2015 and the American Printing House for the Blind, in that, and I quote, "CVI has become the leading cause of vision impairment among children in the developed world," end quote. There's also an increase in the national understanding and treatment of CVI. This is more widespread understanding of CVI leads to a better intervention, which can then be more suitable for students. An increase in requests for TVI and O&M teacher support, which we absolutely really appreciate, especially myself as an administrator. Many of our teachers have reached out to our cohort members for support, which is reflected in our most recent survey. And some of those results will be shared later in this presentation. There's also been an increase in parent and family engagements for children with CVI. We're very happy to report that more of our families are reaching out for help and have a better understanding of CVI. They're now better equipped to ask the right questions of the medical and the educational communities. There's an increase in the school team members and administrators who've been reaching out to CVI cohort members and their TVIs. The implication here is that the more informed the schools are about CVI, our students will ultimately benefit from interventions throughout the day. Teachers who have classrooms with students with multiple disabilities are now more apt to make referrals as they identify more students with CVI. And finally, on the increases, there is an increase in the need for providing more CVI education in teacher prep programs, like at Hunter College. We have been collaborating, the three of us, Dr. Brady, Mr. Russell, and I, about this in the past, probably three years. So we are offering complementary information instead of the same or repeated information about CVI from one course to another. So we do have a second grouping of beginning rationale thoughts. Not only are there multiple increases in various aspects of CVI, but there's also a realization that students with CVI are unique compared to students with other eye conditions, especially when it comes to assessment and intervention. This also includes the physical appearance of the eyes and visual behaviors of students with CVI as compared to their peers with other visual conditions. Since CVI is not an ocular condition, it is often missed if the family or classroom teacher are not aware of additional characteristics that students with CVI exhibit. There have been an increase in referrals as well for students with CVI, which we also appreciate, so we can get to more students in order for them to receive vision services, which also may lead to orientation and mobility services. These are coming from multiple sources, such as TVIs, Teacher of the Visually Impaired, school psychologists, Committee on Preschool Special Education and Committee on Special Education Administrators, classroom teachers and families. And some referrals have also come from, in our case, the New York State Commission for the Blind, counselors and social workers. So as far as some of the processes that I would like to share at this point, in 2004, we started thinking about all of the nuances of what CVI entails. So we met every 8 to 10 weeks during the school year. in the last year, we've even met remotely, what with the pandemic, and only relying on remote platforms. This has helped us to focus on identification and referral of new students with CVI, as well as with assessment of what the group needs, such as professional development, coaching, and the sharing of resources. We have also had multiple opportunities to focus on the development of tools and resources, such as the CVI Assessment Toolkit and fact sheets for families and professionals. It is critical that we make every attempt to follow up with coaching and training requests in order to keep the momentum up. This includes collaborating with vision agencies to ensure that we are also meeting their needs.
This is Chris. I'll share with you very briefly some of the initial outcomes from 2015 to 2018, the first 3 years of the CVI cohort. And these dates in particular are being shared with you and the data from them because in 2018, we rewrote the grant application for the New York Deafblind Collaborative. It's a 5-year federally funded grant, and we started a new grant cycle in 2018. So we gathered a lot of the data on outcomes for each of our different initiatives. And we found that in those first 3 years of the cohort, we had identified and referred to the Deafblind Collaborative more than 15 students who are deafblind, which is a pretty large number when you consider that the entire state's deafblind child count is around 420 to 450. So in 3 years, this cohort had identified and referred a significant number of students. And also, as I mentioned earlier, the total percentage of students who are deafblind registered with New York Deafblind Collaborative as having CVI increased from very low 3% up to 28%, which is probably based on national averages collected by the National Center on Deafblindness, fairly accurate. It should be around 20 to 30% of students with deafblindness are thought to have CVI. Additionally, some of the qualitative data, the teachers involved, as well as the teachers impacted, reported increased skills and proliferation of best educational practice throughout educational vision services. And this truly was a successful example of a train the trainer model, where we had between 7 and 10 cohort members impacting literally hundreds of their peers across the boroughs. In 2018, 2019, the CVI cohort expanded to a more collaborative model as Dr. Brady became the program coordinator of the personnel prep programs at Hunter College. So this became a bit of an expanded model now, and not just between the Deafblind Collaborative and the Department of Education, now impacting pre-service professionals, especially in the TVI programs, the O&M and CVRT programs, as well as the severe and multiple disabilities programs. It also expanded to include additional agencies and departments, including Visions, Lavelle School for the Blind, iHope, and the DOE hospital schools. As I turn it over to Greg on this next slide, you'll hear a little bit more about our cohort community partners.
Thank you, Mr. Russell. According to this chart, it does show that educational vision services makes up about 77% of the CVI cohort. The remaining are our partner agencies, Mr. Russell just discussed, and representatives from there that support students who are deafblind, students with traumatic brain injury, students and adults who may benefit from vocational rehabilitation programs, and students in private agencies. Some of these students range from the most severely disabled to those who are college bound. And now I will talk about some key aspects about the CVI cohort. So we realized it was essential that we treat all members' input and suggestions as valid and essential. We make decisions as a team, and we heavily rely on our team members' recommendations. This also includes follow through on requests for additional training or when a member or someone connected needs resources. CVI interventions must not be done in isolation. This is so important. Student success rather, is made possible because we work with team members to provide CVI interventions throughout the day instead of only during the vision sessions. We emphasize giving the student consistent and repeated opportunities to respond and to demonstrate what is being asked of them. We want to give them the opportunity to prove to you, the teacher, related service provider, paraprofessional, administrator, and especially parents and families, that they can do it. CVI is also fluid and organic. CVI is not static. CVI is intermittent often. How a student responds can be unpredictable or appear to be if we are not paying close attention to detail. Often our notion of how a student should respond is subjective and not always correct. However, we can be more accurate and objective if we are willing to be flexible, open-minded, and patient. With this approach, our students' intervention will become more reliable and valid across the board.
This is Chris. I'll share with you a few examples of some of the work that we've done on the CVI cohort. I think one of the initial main practices and main activities that we undertook was to provide some additional coaching and mentoring around the actual assessment process, in particular of scoring the CVI range, which is a functional vision assessment protocol designed specifically for functional vision assessment of students with CVI. Across the entire range or scale of severity. This is a highly unique and somewhat idiosyncratic protocol and does require some training and some coaching to use, as well as just to interpret the results. So with this initial group of 7 to 10, mostly TVIs, but also some orientation mobility instructors, and now eventually expanded to be a much larger group, including teachers, and other related service providers and educational professionals. Essentially, we would provide assessment coaching for their actual work with students, or a professional might identify a child with CVI who needed an updated functional vision assessment, and a member of the cohort or myself would go and actually do hands-on collaborative assessment together. And I think that this model of peer and collaborative assessment was incredibly effective towards improving each of these professionals' confidence and reliability in terms of scoring the actual CVI range. In addition to the initial assessment scoring and interpreting the results of assessment, we worked together to determine how the results of assessment would be practically applied to intervention for individual students, to working with the rest of the collaborative team and with the IEP team to be able to integrate the results of functional vision assessment into the child's program. This often involved designing and even creating specific adaptations, as well as modifying or providing accommodations for routines to maximize the student's use of vision in various activities throughout the school day across disciplines. As well as to enhancing collaborative teaming approaches to implementing intervention. Say when you have a student who has 4 or 5 related services and it's a fairly large collaborative team, it's important for the vision service professional as well as the classroom teacher to have a good handle on how to work with other team members to integrate visual interventions into their own work so that it's not just an isolated or siloed practice. We also found that sharing individual case studies, which kind of just came about organically, was a very effective way to spread best practices across the entire group, so that it wasn't just one individual working with one individual student. We could bring those as case studies to the larger cohort and talk about what we learned from these unique individual students and their educational settings. In various times, this led to additional or follow-up professional development when we realized, again, somewhat organically, we've done this great work, we've learned something specific from this activity, and it actually brought up a need for additional professional development or coaching in another area, such as learning media assessment or assistive technology, or how to apply visual interventions to communication programs. And this has been another really positive outcome of this work. Okay. And perhaps an even more specific example of some of the work that we've done together, we have created various tools, products, and resources as a group, as a collaborative group, really just when the need has arisen. So one of the first ones that came about was the need for the agreed upon shared need for examples of what goes into an assessment toolkit for conducting functional vision assessment of students with CVI. So we created, as a team, as a cohort, we created these examples, which are essentially inventory lists of what goes into each of the professionals' toolkit. One of the especially crafty TVIs in the group created this inventory list, including photographs of what was actually in their assessment kit, as well as little descriptions, and an X next to which phase of CVI or level of severity of CVI that particular material might be useful for. And you can see sort of some descriptions of various types of materials that might go into an assessment kit. And just to make sure that the assessment kit is broad enough to be appropriate for a wide variety of students with CVI. Okay. We focused extensively on examples of intervention strategies, again, really just naturally as this came up following assessment in terms of the need for appropriate intervention. We focused as a group on case studies and looking at how each individual student, as well as more broadly, what are the trends in appropriate intervention strategies and what are really the best ways to disseminate that information across all practitioners within the department, so that this wouldn't be, again, an isolated community of practice. It was a train the trainer. It is a train the trainer model, rather, where each of the individuals in the cohort is expected to then go on and impact and share this information with their own colleagues across the department and now across agencies. We talked a little bit before about utilizing assessment results specifically to individual students, thinking about accommodations and modifications impacting the individualized educational program, including positioning and seating, environmental control, actual material accommodations such as slant boards or trifold walls, and also more general accommodations such as additional wait time or processing time. Okay. In terms of outreach, we've also developed various materials to spread the word about the work that we're doing as a cohort, as well as to make sure that colleagues out in the field within the Department of Education, as well as across agencies, actually had a knowledge of us, the cohort, as a resource that could be more broadly available to the community. Some of the professionals in educational vision services in the group had the idea to create a flyer, a sort of general information flyer, which could serve as almost like a fact sheet on visual red flag behaviors for children with CVI, and created this in a way that would be very user friendly and not, full of jargon, but rather just appropriate to being able to help peers who didn't know much about CVI out in the community and in the various community schools and agencies to help to identify and refer those students so that they could, if necessary, follow the process of obtaining visual services. Okay, I'm going to turn it over to Beth here.
So after all this wonderful work was happening, we were trying to figure out, how do we capture this? How do we share this out? And what impact is it having? So just recently, after we had that initial 2018 set of data, we've been trying to collect a little bit more from from our partners, including that expanded cohort. So some of the other agency partners as well. So in this latest round of data collection, we had 15 survey respondents from the 7 organizations and departments. They reported out that they believe they had impacted at least 350 or more colleagues with resources, mentoring, coaching. If you think about, a teacher going into a busy school building, talking to OTs, SLPs, all of that. So we wound up at the number of 350, which is just awesome to see. We've identified 84 new children as having CVI, and then 33 of those new children identified also had deaf blindness and were referred to the New York Deaf Blind Collaborative. The other piece too is that the students that we're referring are not necessarily students that have CVI as well. We're also identifying other students with just an ocular visual impairment to the Deaf Blind Collaborative as well. I know that happened in my situation where I was with a student and I was with a student and I knew she was deafblind and she wasn't on their records. And she was maybe 18 years old at that point. So just reconnecting and just being aware and looking out for connecting the staff and the Deaf Blind Collaborative is just another little thing that kept happening. And all the teachers are reporting similar experiences. So generally, the results from our participants are really positive. Teachers are feeling good about what they're learning. They feel like they're gaining skills and knowledge to identify students with cortical visual impairment. They're feeling like they have stronger skills to assess students. And then they're planning that intervention piece as well. So between 86 and 93%. What's interesting is then 100% of respondents felt that they were prepared to support their colleagues and other professionals in the field and to support families of children with CVI to achieve improved outcomes. I mean, out of 15 respondents, that every single participant felt that way. That was really great to see, and also made it important that we're capturing this work as well. And then there was confidence. So we were starting to assess that self-efficacy piece. I feel confident in my ability to reliably identify, assess, and provide recommendations for intervention for children with CVI across phases, 93% of respondents. I feel confident in my ability to train, coach, and mentor TVI colleagues. Again, 86% of respondents. So, the impact is there and we're going to continue to measure it as we go forward as well. There's a couple of different directions that we're also going to take this in terms of the research. So obviously we're sharing this work with you all today, but we also want to expand this survey and see what impact on New York City TVIs. So there's, some of those TVIs are members in the cohort, but there's a larger group of TVIs in New York City that we haven't even, I think we did an initial survey a few years ago, but it's time to follow up with and see, are we having a greater impact? And then also there's members who have rotated on and off the cohort. So either they've moved into different roles, like I was on the cohort a couple of years ago as a teacher. So, what was the impact a few years ago versus this year and going forward? And then in terms of another data set is just, again, looking closer at those numbers of how many students are we identifying. So we have some internal data from New York City. We have the child count, the national child count for students who are deafblind. And then also New York State collects data in terms of who's registered as legally blind and able to access federal quota funds. So kind of comparing those numbers is going to tell us a lot about potential impact of this work as well. And then because we have this unique large set of TVIs, there's a lot that we could do at the student level and comparing our notes in terms of what are we finding, what's working in terms of intervention, what's working in terms of assessment, how effective do teachers feel in their assessment, and how are they teaming with other professionals. So there's a lot more we can start to look at that down at that student level as well, which I'm excited to be part of this team and sort of go with this and see where we go with it. So another piece of the survey was that we did ask for, just little sound bites of, give us I think the prompt was, what would you like to share with us about the cohort? So these are just some of the takeaways that we have at this point.
This is Chris. Just to highlight, and each of us are going to highlight a couple of quotes that we pulled from the survey. And you've seen there, we sort of bolded some of the key sentences and ideas there, and you can read the rest. But we wanted to highlight a couple of these ones here. So one participant or cohort member said, "It is very comforting and professionally reassuring to have the cohort and its leaders available to learn from and rely on for information and assistance at any time." Another cohort member said, "I've gained knowledge from this cohort that I could not have received elsewhere." We're happy to get some of this feedback and just to think about what the broader impact is beyond what we've collected quantitatively.
Another member had to say that the cohort has given me the opportunity to discuss with other professionals current issues facing our CVI community today, and to jointly come up with ideas and solutions to give my students the chance to achieve progress and success in all areas.
And I would like to read one of the quotes from one of our teachers, and being a teacher, a former teacher of the visually impaired myself, I am really happy to see this. The teacher said, and I quote, "The New York Deafblind Collaborative and New York City Department of Education CVI cohort has been an invaluable resource to me as a teacher of the blind and visually impaired. Being part of the cohort has elevated me as an educator, allowed me to provide quality assessments and implement effective intervention to my students." And I would also like to share some of the highlights that we provided you with this graph, but I wanted to elaborate on some of them and expand on the survey results in the areas of continued professional needs. So one of them is intervisitations. And what this is, it's between TVIs and O&M teachers as professional development, peer-to-peer learning experiences. In EVS, we encourage this for all teachers and also allow them to have time to set aside in their schedules for this each week or as needed. And they do utilize this time a lot. More coaching for assessment was another one of the items here. And this has become very beneficial as more and more cohort members and teachers learn strategies for the best or most fitting functional vision assessment template, or to use to know which materials and resources best should be incorporated into the assessment. Intervention strategies are always being built upon, fluid and organic, as we all work to better understand CVI. We do hope that in the future, CVI interventions can become more consistent and universal. And one of the other items that I want to highlight, more information on literacy approaches. It's not just about a teacher helping a student to focus on an object without purpose or to diminish a visual behavior or CVI characteristic that is not optimal. It is about the student becoming more independent and able to communicate his or her needs in school and at home. Based on this graph, it appears that as a priority, communication for students with CVI received the highest percentage from the participants in this survey. So where does that bring us? Future endeavors, this is also very organic. As education, training, and outreach endeavors progress, we must reassess. Ongoing assessment is critical. The need and purpose of the CVI cohort and everything associated. We may want to combine the cohort with other related services, such as speech and hearing services. We want to think about providing more training and professional development in a more widespread arena, local and nationally, possibly, and possibly internationally. To include parents and families in the cohort or encourage a separate cohort for families. And we have more future endeavors to possibly create videos and incorporate technology into aspects of the cohort. Update assessment templates for students with CVI who are learning in person or through hybrid or remote models and platforms, which we are predominantly using today. Share suggestions and success on social media platforms. We want everyone to know how well our kids are doing. Possibly write and publish from online social media to peer-reviewed journals. All kinds of ways to publish and get the word out. And finally, to continue to build on and share our understanding of CVI in order to accelerate and enhance learning opportunities for our students. With that said, I wanted to, on behalf of Dr. Brady and Mr. Russell, thank you to everyone who participated in this presentation. Please refer to our reference list we provided you, and if you need to reach out to any one of us, feel free to use the contact information we're providing. Thank you very much.